Pharmacist Ben.
AJ, Sportus Nutritionosis, good to see you as always.
How are you today?
I am good. Thank you
Looking
for inviting.
spiffy. Must have been a busy day.
Yeah, I had a busy day. I tell people as busy as I want to be, which is I like to be busy. I like to do stuff. My mom's 90 years old. She's always doing stuff. And I say, Mom, take a rest. And she says, I'll rest when I'm dead. And that's kind of how I feel. Life is for living, doing stuff, making it happen. And there's plenty of people out there who need what we have to offer, who need to hear what we have to say.
You got that right. I guess we have.
Are we live?
We are live, and thanks for joining us today. We have a couple questions. I guess did you just bring Becca Dukes on the screen with us?
Did I do that?
I guess you must have.
I don't know if that was me.
At any rate,
there's no keeping Becca out of here, man.
it's impossible. Somehow, some way, her fingerprints are going to be on the scene.
Becca, we love Becca, and you're looking skinnier, more beautiful every time I see you, Becca.
Oh, thank you. You're so sweet. Yeah, even vacation can't keep me away.
That's funny. Are you on vacation? Is that why you're in your car? That's why we see you in your car?
Kind of, sort of, yeah.
Okay, got you. Where are you? Can you say?
I am in the Phoenix area.
Got it. Okay, good deal. All right, so what do you got here for us, AJ?
Well, Becca's got a question that we're going to start with. I mean, obviously, we're going to get some engagement from our health coaches and the rest of the community, but Becca's got a question that we're going to start the show off with.
Okay, what's up, Becca?
Pharmacist Ben.
Yes, Becca.
When looking at mental health, there are so many different pharmaceuticals can be thrown at different conditions, mental conditions.
Okay.
When we're looking at helping an individual, and I know that there are some times where pharmaceuticals can be an absolute necessary. What are some things that we can do to help people when it comes to giving them something to look at when it comes to mental health?
Okay, so from a mental health perspective, working with nutrition and diet and lifestyle, and that always plays a role. Things like exercise and sleep and laying off of sugar and processed foods and working on digestive health. These are all strategies, and I'll talk about these a little bit in a second. These are all wonderful strategies for dealing with psychological issues. I prefer saying psychological issues than mental issues because psychology encompasses mental and emotional. So when I think of mental health, I like to think of psychological issues. So there's certainly physiologic reasons why people would have psychological problems. But that being said, if you have a psychological issue, it's important that you address your psychological issues psychologically. And that means working with things like cognitive behavioral therapy, for example, going into dealing with trauma from a psychological perspective. One thing that you can that's associated with psychological health problems or psychological health challenges is activation of the fear response. For example, there's a condition called post-traumatic stress syndrome, PTSD. Now, a lot of people think of post-traumatic stress syndrome. We think of people coming back from Iraq or people coming back from Afghanistan, military folks. They used to call post-traumatic stress syndrome shell shock in World War II. Maybe World War I, they called it shell shock. So today we call post-traumatic stress syndrome post-traumatic stress syndrome, PTSD, or stress disorder, PTSD, and we associate it with people who are coming back from military situations, but people who have had child abuse. And by the way, there was a study called the Adverse Childhood Experiences Study. I don't know if you've heard of this, the ACEs study that came up with some conclusions of maybe 20 years ago. I'm guessing. I don't remember exactly when it was. And they found that almost all chronic health challenges, or almost all patients who deal with chronic long-term health challenges, have some kind of adverse childhood experience associated with that. So post-traumatic stress syndrome, whether it's linked to military or whether it's linked to childhood or whether it's linked to some kind of trauma that somebody had, some assault or all the horrible things that can happen in life, is linked to an activation of the body's fight or flight nervous system, the sympathetic nervous system. So you have we've talked about this a lot. I don't want to bore anybody by repetition, but it's really important. You have two nervous systems. The nervous system in general is the system that turns input from the outside world into biochemistry. Of course, there's also inputs from the inside world into biochemistry, but we'll talk about inputs from the outside world into biochemistry. Your sight, your nose, your smell, your taste, your ears, your touch, what we call the senses, are the outposts or the periscopes for the inside world to see what's happening in the outside world. And the senses, signals come in from the outside world, hit the senses, and they get transduced into biochemistry. But what's missed is there's two nervous systems. There's a nervous system that channels experiences into emergency chemistry, and there's a nervous system that channels experiences into safety chemistry. All the good stuff in life is linked to safety chemistry. Fertility, imagination, and creativity, and good immunity, and growth, and repair, and healthy digestion, and a functional thyroid, a healthy functioning thyroid, and healthy blood sugar. All these are linked to the rest and digest safety nervous system, technically called the parasympathetic nervous system. Emergency conditions will lead to an activation of the emergency nervous system, the fight or flight nervous system, the sympathetic nervous system, as opposed to the parasympathetic nervous system. And it should come as no surprise to folks that all our chronic health challenges are linked to hyperactivity at the level of the sympathetic nervous system, hypersympathetic activity. The sympathetic nervous system is designed to get you out of a jam, to get you out of, from an evolutionary perspective, to get you away from tigers and lions and bears and animals that wanted to eat you, or to somehow to get you into a safety situation from a fear situation. And the way nature intended is the sympathetic nervous system would get activated, and then it would get resolved. So you'd run away from the saber-toothed tiger or whatever it was, and all of a sudden your parasympathetic nervous system would be activated. So the sympathetic nervous system is not designed to be activated chronically. But in our culture, we have created a society that is almost intentionally designed, or is designed to intentionally activate the sympathetic nervous system chronically. And this is what post-traumatic stress syndrome, post-traumatic stress disorder is. It's a sign of a chronically activated fight or flight nervous system. People who have this PTSD condition are always in fear. And the sympathetic nervous system is associated with high blood pressure. It's associated with poor growth and repair. It's associated with reduced fertility and reduced creativity, and increases in anxiety and anger and fear and all the yucky stuff. One of the things that the sympathetic nervous system does when it's activated is it suppresses the immune system. So people who have an chronically activated sympathetic nervous system will have suppressed immunity. They'll be prone towards infections. They'll be prone towards inflammatory responses. The sympathetic nervous system also suppresses the digestive function. So people who are chronically sympathetically activated will have chronic digestive problems. They'll have chronic absorption problems, malabsorption problems. Pretty much all disease states have an activated sympathetic nervous system component, and that includes mental or psychological health issues. So while psychological health issues should be addressed psychologically, from a physiologic perspective, telling the body to stand down, giving the body physical signals. Yes, psychology is important. Cognitive behavioral therapy is important. Meditation is important. But giving the body signals from a physiologic perspective that it's okay, that it's safe, will activate the parasympathetic nervous system and deactivate the sympathetic nervous system. One of the best ways to tell the body it's safe is to breathe. Oxygen calms down the sympathetic nervous system. And breathing correctly is important, because if you breathe incorrectly, you can actually make matters worse. You can actually create a fear response by breathing incorrectly. Slow breathing activates the relaxation response. In fact, slow anything activates the relaxation response. Moving slowly. You ever see people in the park moving slowly and doing these exercises really slowly, called Tai Chi?
Tai Chi, yeah.
Tai Chi, right? Tai Chi is when you move your body really slowly. And these slow movements tell the body it's safe, tell the brain it's safe, and activate the parasympathetic nervous system. If you're moving really fast, that tells the body there's an emergency. So telling the body it's safe by moving slowly is a great strategy. Breathing slowly is a great strategy for activating the parasympathetic relaxation response. Copious and generous micronutrients tell the body it's safe, tell the body it's okay to grow. The body isn't going to it isn't going to expend resources on growth and repair and immunity and all the good stuff in life if it thinks it's in a dangerous situation. Micronutrient supplementation tell the body it's safe. On the other hand, calories, high energy without micronutrients gives the opposite signals to the body, activates the emergency response. And this is one of the biggest problems we have in our culture today. We're overfed and undernourished. And overfeeding and undernourished creates a whole cascade of biochemistry that ultimately can activate the sympathetic nervous system. And this is why obesity and overeating and excess ingestion of sugar are all associated with the stress response, with the cortisol response. So making sure you're getting increasing your micronutrients and decreasing your macronutrients. In fact, when you increase your micronutrients, you'll automatically want less macronutrients, proteins, fats, and carbohydrates. Remember, as we said before, the micronutrients help the body utilize the energy from the macronutrients. This is the difference between feeding and nourishment. A lot of times, folks in the medical model don't make that distinction between feeding and nourishment. And they'll tell people who are really sick to make sure they're getting a lot of calories because they don't want them to starve, but they're missing the fact that it's the nourishment, not the feeding. It's the nutrients that count, not the calories that are as important. Of course, you do need a certain amount of basic calories. So make sure you're getting a copious, generous amount of micronutrients is important for telling the body it's safe. And then there are specific nutrients that can be helpful for mental health, for brain health. Omega fats are very, very important, particularly omega-3 fats, especially omega-3 fats that come from fish. Now, omega-3 fats that come from fish are not necessarily essential fats. And this is a really important point. Essential fatty acids, EFAs, are technically speaking omega-6, an omega-6 fat called linoleic acid, and omega-3 fat called alpha-linolenic acid, or LA and ALA. Fish doesn't really have omega-3 essential fatty acids, but it's got two fatty acids that are very important, not essential, but very important for the brain. One is called EPA, and another is called DHA. DHA, I think, yeah, DHA and cosapentanoic acid and EPA. And these two fatty acids are not essential, but they're very important for brain health. In fact, they're so important for brain health that mothers who are pregnant would be very wise to use EPA and DHA for helping build their baby's brain. These two fats that come from fish oil will make your baby smarter. Will give you a baby that's got better hand-eye coordination, better athletic performance, better vision. Also, these omega-3 fats, these DHA and EPA, are very important for the nervous system. They're very important for the skin, in addition to being very important for the nervous system, and they can help calm down skin reactions. DHA and EPA, in addition to being important for the brain, they're important for folks who are dealing with psoriasis or who are going out in the sun, who want to protect themselves from sunburn. Even DHA and EPA has actually been shown to protect you, to have protective benefits from EMF, electromagnetic frequency, because of their ability to modulate electrical energy. That's what these two very important fatty acids do, but they're also very important for the brain. Vitamin E, mega important for the brain. And all of these things that I'm telling you about that are important for the brain are also going to be important for folks who are dealing with dementia, which is an organic brain issue where the brain actually deteriorates. So vitamin E, omega-3 fats, magnesium, zinc, niacin, one of the all-time great mental health or brain health nutrients. In fact, niacin is so important for mental health and psychological health issues that it's used to treat social anxiety disorder, in addition to helping treat schizophrenia. And in a way, nicotine, right, the stuff that you get in cigarettes, has a chemical similarity to vitamin B3 or niacin, which is also known as nicotinic acid. So this is thought that people smoke cigarettes in order to get the nicotine, at least partially, in order to get the nicotine for calming the brain down. So you don't need to go into nicotine. You can use your vitamin B3, your ultimate niacin from longevity. All mental or psychological health issues, folks who deal with mental or psychological health issues should be using vitamin B3, the ultimate niacin. But particularly if you have a full-blown issue like a psychotic issue or social anxiety issue or dementia issue, niacin is a fabulously important vitamin for treating dementia. In fact, niacin deficiency disease is called pellagra, and pellagra, the three major symptoms of pellagra are diarrhea and gastrointestinal problems, dermatitis, skin problems, and dementia. They call it the 4Ds. The fourth D is death, because if you don't have enough niacin, you finally die. They call it the 4Ds of pellagra: diarrhea, dermatitis, dementia, and death. So for folks who are dealing with PTSD or mental health issues or dementia issues or anxiety issues, using your ultimate niacin can be very helpful. Then there's the blood sugar connection. Do you know insulin used to be a psychiatric treatment? They used to use insulin for psychiatric problems. For folks who are in mental institutions, they used to give them insulin. Why? Because insulin would lower the blood sugar. And it's known, as any parent can tell you, that when their kids eat sugar, they go crazy. They bounce all over the room. So reducing sugar is important, and working on the blood sugar system is important. This is where our triangle of disease comes in. Remember, the triangle of disease is underneath everything. Every chronic health condition has these 3 points. I know we've shrunk them down to 2 points and then to 1 point, but going back to our triangle of disease, 3 points. Cortisol is the stress system. So stress is going to affect the brain, psychological stress as well as physiologic stress. Blood sugar will affect the brain. And by the way, Alzheimer's disease is called type 3 diabetes. It's a form of diabetes. And going back to our niacin is not only important for mental health and brain health, it's also important for the blood sugar system. No coincidence. So working on the blood sugar system, using your sweeties, using your ultimate niacin, getting on the osteomag, which is also important for the brain, as well as for the blood sugar system. The selenium, the ultimate selenium, is important for insulin and also important for the brain. So working with the blood sugar system, of course, lowering your sugar, that goes lowering your intake of fast-burning sugars, high glycemic index sugars, processed foods and sweets and soda pop and even fruit juice can be problematic for the blood sugar system. So reducing your intake of those 3 sugars. And then, of course, there's the first point on the triangle of disease, which I was actually going to talk about today because I had this really interesting letter. When you have digestive health issues, toxins are released into the bloodstream that can induce anxiety and insomnia and activate the stress response in general. So making sure you're addressing digestive health issues, in particular a molecule called histamine, which we've talked about in the past. Histamine, there's 3 main sources of histamine. Foods can be a source of histamine. There are cells, immune cells in the body, white blood cells in the body that will release histamine under conditions of immune activity or immune assault. And then there's histamine that's made by bacteria in the intestine. Once histamine starts streaming into the bloodstream through a leaky gut, and histamine can also cause a leaky gut, that can cause issues with mental health. And in fact, histamine is a brain chemical. Histamine is a neurotransmitter that's associated with mental health problems and psychological health problems and anxiety issues. This is why when you take an antihistamine, what happens? You relax. In fact, you relax so much you get drowsy. In fact, most folks don't realize this, but the pharmacists out there know that antihistamines are used to treat schizophrenia. Antihistamines are used to treat psychosis. Again, showing you the relationship between histamine and mental health issues. Now, it's going to, these are all wonderful strategies for dealing with mental health problems. Omega Fats, your Healthy Start Pack, which will feature Omega Fats. Synaptive, don't underestimate the power of the Synaptive product, one of the Longevity's most important non-essential products. It's not like the Healthy Start Pack for sure, but it's a great accessory product, especially for folks who are dealing with mental health problems. I was going to talk about histamine anyway today because I got a really cool letter, not cool, but interesting letter from my friend Tom Chenault, who you guys know. He says that he says there's a gal he knows is having a great experience with the Healthy Start Pack, but wants to know what else. And here's a list of her symptoms. And this, I just had to chuckle to myself. I know I didn't mean it in a bad way, but it was just so interesting. Here's a list of her health issues. Allergic contact dermatitis. Okay, that's rashes on the skin. That contact dermatitis is when you touch something and all of a sudden you get rashiness. Contact means you're touching it and you get a rash. They're giving her Dupixent for it. Seasonal allergies. They're giving her steroids for it. Asthma. They're giving her steroids for it. Osteoporosis. They're giving her injectable bisphosphonates, which is among the most toxic and deadly drugs you could ever take. GERD. They're giving her Nexium. GERD is gastroesophageal reflux disease, heartburn, splashback. Arthritis. She's got anxiety. She's got poor sleep, insomnia. She's got depression. She's allergic to all furry animals, and her appetite is lacking. What do you think every one of those symptoms? Now, if you don't know, you haven't listened to us speak here, you haven't listened to our talks, what do you say? Okay, there's all these different things. They're all GERD and asthma and osteoporosis, and they seem to be all different, right? So what do? She's going to the doctor and she's getting a drug for allergic contact dermatitis, a drug for allergies, a drug for asthma, a drug for osteoporosis, a drug for her GERD, a drug for arthritis, a drug for anxiety, all different drugs.
It's horrible.
But what do all these things have in common? Every single one of these have in common. I'll tell you. Histamine. Histamine causes allergic contact dermatitis. Histamine causes seasonal allergies. Histamine causes asthma. Histamine is linked to bone problems. Histamine is linked to excess acid in the stomach and GERD. Histamine is linked to inflammatory disorders like arthritis. Histamine is linked to anxiety. Histamine is linked to poor sleep and insomnia. Histamine is linked to depression. Histamine causes appetite suppression. And histamine will make her allergic to furry animals. Every single one of these symptoms that look like they're all disconnected, right? It's like your fingers, right? If you don't see your hand, you just see the fingers. They look like they're a bunch of fingers, and you pull back and you see it's a hand. It's all connected to one thing. Histamine comes from a leaky gut. Histamine comes from ingestion of the wrong kinds of foods. Histamine comes from a chronically activated immune system. Bingo. The first point on the triangle of disease, every single one of these. I'm going to talk to this lady tomorrow. We're going to change this lady's life. Now, she's getting benefits from the Healthy Start Pack because she's now getting some good nutrients, especially some good antihistamine nutrients. For example, the Beyond Tangy Tangerine contains one of the all-time great antihistamines, which is vitamin C. So the Beyond Tangy Tangerine contains natural antihistamines. So, of course, she's going to notice benefits from the nutrients. Plus, once you get enough micronutrients into your system, the body feels a little bit more safe, and that's going to tell the body to stand down. So she's getting benefits. She wants to know what else she can take. Tomorrow, we're going to change her life. When I talk to her, I'm going to tell her exactly what I'm saying to you. She's not going to hear that from anybody. There's none of these doctors, are assuming there's multiple doctors, and maybe it's one doctor. I hope not. But if it's one doctor or multiple doctors, they haven't told her anything about digestive health. By the way, I talked to this lady a little bit today, and I asked her about her digestive system. Sure enough, she's had digestive problems since she was a kid. Now, I didn't get a chance to go through a full-blown consultation. We're going to do that with her tomorrow, but I didn't need to know. I could have told her that. Again, there is no chronic health condition. Rebecca, to answer your question, anybody listening about mental health, there's no mental health condition that's chronic. There's no metabolic condition that's chronic that is not linked to a leaky gut, which in turn is caused by bacterial overgrowth, SIBO, small intestinal bacterial overgrowth, which in turn is related to lifestyle issues, all of which is to say, we have so much more control and so much more power over our body's biochemistry and over our disease, our health challenges than we're being told. It all reduces to the triangle. And if you want to go right to the source, it's to the first point in the triangle of disease that leads to everything. It's the foods that we're eating, and it's the digestive system, the health of the digestive system, which is the stomach, the liver, the pancreas, the gallbladder, and the intestine. But it's really the intestine is the first place that you want to focus on. The intestinal health, particularly with small intestinal bacterial overgrowth. And by the way, one of the all-time great longevity products that's not part of the Healthy Start Pack, it's really not in any packs, I don't think. Correct me if I'm wrong, Rebecca, but we don't talk about it anywhere near enough, and I absolutely love this, and Doc loves this too, is the I-26. What is the I-26? There you go. I-26. What does the I-26 do? It kills the SIBO. It naturally reduces the bacterial load in the small intestine. Now, these days, it wasn't that long ago, maybe 5-10 years ago, nobody knew what SIBO was. But these days, doctors are starting to understand that there's a relationship between intestinal health and other chronic diseases. So they give people antibiotics for SIBO, which, of course, is not a very intelligent solution because you're going to kill all the bacteria with antibiotics. I-26 is specific for the bad bacteria that accumulate in the small intestine. So if you're dealing with SIBO, if you have, and you can assume that if you have other health challenges that you are dealing with SIBO, but especially if it's, you're bloating and you're gassy and you have bowel problems with your bowel movements and digestive discomfort, you've had a gallbladder removed, SIBO, get yourself on that I-26. Yes, sir.
I have a question.
Let me just say one last thing. There's a very important connection between SIBO and blood sugar. So dysbiosis, which means messed up gut bacteria, is a precursor to dysglycemia, which means messed up blood sugar. And dysglycemia, in turn, will increase bacterial growth and bacterial proliferation in the small intestine. It's a circle. So dysbiosis, messed up gut bacteria, leads to dysglycemia, which makes dysbiosis worse, which makes dysglycemia worse, and dysbiosis and dysglycemia, again, showing you how important it is to focus on intestinal health. Yes, sir, Mr. AJ.
Becca, I hope that answered your question.
Yes, okay. It does.
And you know what? It actually answered our question, because I realized that Ben wasn't low on his volume. You were just a little loud on your volume.
Who, Rebecca? Rebecca was?
That's
okay.
That's what it was. But at any rate, lovely Becca, Ben,
let me say one more thing. I talked about the Beyond Tangy Tangerine for histamine. Another great reason why I love the Beyond Tangy Tangerine is because it's absolutely packed, loaded with the B complex, which are also very important for mental health issues. And in fact, there's a mental health condition, or literally an organic brain condition, called Werner-Korsakoff syndrome. Have you heard of this, Werner-Korsakoff syndrome?
I've heard it mentioned, but I don't know much about it.
Werner-Korsakoff syndrome is also known as alcoholic psychosis. Werner-Korsakoff syndrome is a disease, a brain disease. There's other bodily symptomology that goes on with Werner-Korsakoff syndrome, but in the brain, it shows up as psychotic behavior. And if you ever seen alcoholics, homeless folks or people on the street drinking beer out of the paper bags, and they're talking to pink elephants and leprechauns and they're hallucinating, that's a classic example of Werner-Korsakoff disease, alcoholic psychosis. And they'll actually take these alcoholics and they'll put them in the drunk tank. And guess what they put right in their blood that cures the condition instantly? Vitamin B1, thiamine, which is one of the reasons why the BTT is such a fantastic supplement. And I will tell you this, thiamine deficiency is one of the great undiagnosed causes, or I don't want to say direct causes because there are a lot of causes, but associated causes of all chronic health challenges, including chronic constipation, peripheral neuropathies, and dysglycemia, blood sugar problems, because vitamin B1 is very important for helping the body process sugar. So thiamine deficiency, I believe, is much more common than anybody realizes, because the RDA for this incredibly valuable vitamin, the first vitamin, by the way, to be discovered back in the 1890s or so, the RDA for this super valuable vitamin is like 1 milligram or 2 milligrams a day. You need hundreds of milligrams a day, at least 100. And that's one of the reasons why the BTT is so valuable. It's got lots and lots of this vitamin B1. I was going to tell you something else about vitamin B1, but I forgot. But vitamin B1 is also very important for the brain, for folks who are dealing with chronic constipation. I used to use thiamine, by the way. Mosquitoes hate thiamine. So I used to make an anti-mosquito cream in my compounding pharmacy, and I put thiamine in it, and mosquitoes would hover around your skin. So anybody who's dealing with a mosquito problem, I know in Houston, I was just reading, there's a big mosquito outbreak in Houston. Our friends Ray and Yolanda, if they're listening out there, get yourself some vitamin B1, put it on your skin, and mosquitoes hate the stuff.
So is the Tangy Tangerine drink your favorite micronutrient drink?
Yes, it's not a multivitamin though. It doesn't have enough. It's not going to be a multivitamin. You still need some kind of multivitamin with it, like I forgot the name of the Youngevity multivitamin. The Longevity's got a great the Ultimate Multi, I think. Is that what it is?
The Ultimate Daily?
Ultimate Daily. Yeah, the Ultimate Daily. You still want your Ultimate Daily. You still want the Ultimate Daily. You'll get everything, but you don't get the really high doses like you would. You want the Ultimate Daily too.
All right. Well, thank
I
you
like to
so
be on.
much.
I like the BTT because it gives you flexibility.
Uh-huh.
Like you can do a little bit in the middle of the day. You can sip on it. You know, when you take a vitamin like the Ultimate Daily, your blood levels go up and then they go down. But if you drink in your BTT, you keep your blood levels nice and stable. It's like an IV drip. You know, if you're drinking it slowly, and your body likes, as I was saying earlier, your body likes to take in nutrients slowly. It likes to do everything slowly. And so nutrient absorption is maximized with divided doses. In fact, that's just a general rule. Sometimes people say, should I take my supplements all at once, or how do I take my supplements? Divided doses are always the best way to take your supplements. Now, with pills, you can't really divide the dose as much as you can with a liquid. With a liquid, you can just keep divide every second. You can essentially get some multi nutrients in your system. With pills and capsules, you can't do that, but you can divide the dose 3 or 4 times a day, and that's always the best way to take your supplements, is in divided doses.
Fantastic. Thank you for letting me be part of Tuesday Bites with Pharmacist Ben, or Pharmacist Ben Bites.
Thank you. Who else?
Thank you.
Are you going? Is that a goodbye?
I'm still going to listen.
Oh, okay.
Because you always have great stuff to say.
Well, it's great to see you.
Thank you. You as well. You guys are doing great.
Thanks, Becca.
Bye. And then, we should say Sportus Nutritionosis.
Yes, sir.
To people who are listening, who are just listening and not part of the Longevity family, we're looking for business builders. And we can teach you how to be a health coach. We can teach you how to be somebody who could support your loved ones or your friends or strangers, nutritional lifestyle with the Healthy Start Pack, with all of the various products that Longevity has, and with information, because we're all about sharing information about all this stuff. Myself and AJ and Rebecca and Doc and Dr. Shannon and all. There's so many wonderful, Dr. Conaway. There's so many great health professionals, Dr. Laura and Stan. I'm sure I'm forgetting some people who really want to make a difference. And if that sounds intriguing to you, we're looking for folks who can be our allies, be our associates, work with us, be on our team to help change the world with the power of the understanding of how nutrition can change lives, how fundamental nutrition can be. Because, I'm going to say this all the time. I know I've said it on all these bite shows and all the Daily with Doc shows that we've done. Hosea 4:6, my people perish for lack of knowledge. Yes, we can change the world by providing this kind of information. If that sounds good, contact AJ or contact Rebecca or contact whoever invited you to this call and join our team. And we'll help you make money. We'll help you change lives. We'll help you become even more valuable to your friends and your loved ones than you probably already are, by helping them understand their bodies. And hopefully they'll join the team as well.
Ben, before I ask the next question, what you were saying a few minutes ago brought up a couple of quick questions. Number one, there was a woman who made a comment to me about the I-26 chewables.
Yes.
And said, why is there sugar in there?
Well, how much sugar is in there? There's how much? I don't think there's sugar in the powder. There's
no sugar in the powder.
No, I use the powder. Is there sugar in the tablets?
In the chewables.
Oh, okay. To make it tasty. Otherwise, it would be egg powder. What kind of sugar is in there?
It doesn't say. It just says 4.5 grams of sugar.
What's on the ingredient deck? Does it have ingredients?
Just hyperactive immune powder. Other ingredients: sugar, stearic acid.
Yeah, just a sugar.
It says sugar. Yeah.
I use the powder. It's not sweet. I put it in my smoothie. The reason the chewable is, so it tastes good.
Absolutely. Okay. And then you just said that Tangy Tangerine is not a multivitamin.
Well, no,
you're throwing me off, buddy.
Yeah, no, that wasn't accurate. It's not a complete multivitamin. It doesn't have. It's not going to have everything you need in enough of the amounts. I don't believe.
And then it has some things in tremendous.
Yeah, but it doesn't have enough of the mineral. It does have the vitamins. It does, but it doesn't have the minerals. It is a multivitamin supplement. I stand corrected.
Okay. Tangy Tangerine has the plant-derived mineral complex.
Absolutely, it has minerals in it, but it doesn't have the high doses of the minerals that you need. There's not a high enough dose of zinc, for example. There's not a high enough dose of magnesium, for example. There's not a high enough dose of selenium, for example. There's not a high enough dose of MSM, even though there's MSM in there. So, for example, read how much zinc is in there.
This is 2.0, and I don't even think zinc is. It's
in there.
Yeah, 3 milligrams.
Yeah, you
27%.
Right, you need 10 times that. So the point is yeah, I think you're right. There is all the vitamins are in there, but the minerals aren't in there in a high enough content and a high enough concentration to make it just all you need. However, for most people who aren't supplementing, present company excluded, because we're all supplementing here, but most of the public, it's gonna rock their world because it does have such a high concentration of the water soluble nutrients. It's super dense in the water soluble nutrients, especially the B's and also C. And remember, the more nutritionally deficient you are, the faster your body absorbs nutrients. This is the longevity superpower, I call it. Is most people are so nutritionally deficient that this rapidity of absorption that's associated with lack of nutrients is going to impact almost every one of our customers because they're so deficient. So all of a sudden they put BTT in their system, boom. And everybody who's doing longevity as a distributor knows and has stories of people who do BTT and the Healthy Start Pack, and it completely transforms their life. And that's because the sicker you are, the faster you turn it around, the more nutritionally deficient you are, the faster your body absorbs the nutrients. That's the longevity superpower.
So on YouTube, our good friend Dave is asking us, can age be a factor in SIBO?
Will age make it worse? Not age necessarily age, but the biochemical breakdowns that most people suffer with age. It's not like it's inevitable. It's not like it's inevitable that as you age, you're going to have more SIBO. But unfortunately, as we age, we get sicker. Our biochemistry gets worse. As we age, our stomachs, we don't make as much stomach acid. That causes SIBO. As we age, our bile secretion is not as effective. That can lead to SIBO because bile and acid kill bacteria. So as we age, there are other factors that can induce SIBO, but not necessarily. In other words, you don't have to have deficiencies in stomach acid as you age if you take care of yourself. You don't have to have bile problems or gallbladder issues or liver issues if you take care of yourself. You don't have to have chronic constipation and chronic digestive problems if you take care of yourself. But for most people, as you age, those are going to get worse. So yes, SIBO will get worse. Did I answer that? Do you understand what I'm saying there?
Okay.
It's not inevitable, but for most people, because our biochemistry suffers as we age, yes, SIBO will get worse as we age. Dave, let us know if I answered your question.
And
I saw a note here, and I got to raise our attention. This is from Rebecca probably. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any disease. Horse hockey, baloney, baloney. Of course, we're trying to get you better. So, and I don't care. It says not been valued by the FDA. Who cares? The point is we're talking biochemistry here. We're talking biochemistry. We're not talking about diagnosing. There are 44,000 different diseases that can be diagnosed. Did you know that, Sportus Nutritioniosis?
I did not know that.
44,000. But guess what? From a biochemical perspective, there's only one disease in terms of chronic health challenges. It's called MBFA disease. It's the only disease there is. My body is falling apart disease. That's the only disease there is. So let the medical people have their names and their diagnosis. We're talking chemistry here. We're talking biochemistry. Remember, I know you like basketball. What was that guy's name who played for the 76ers?
Dr. J?
Not Dr. J. He goes, practice. We're talking practice.
Oh, my buddy, Allen Iverson.
Allen Iverson. He goes, practice. We're talking practice. No, that's like disease. We're talking disease. No, it's not disease. We're talking biochemistry. Biochemistry.
Wait till he sees this one. Okay.
Practice. We're talking practice. Disease. We're talking disease. You can have your disease. Look, name a disease. Name a disease for me. And
Diabetes.
Diabetes, dysglycemia, disturbances in blood sugar. Your insulin isn't working, so your blood sugar goes up. Diabetes is the disease. Dysglycemia is the chemistry. Diabetes doesn't matter. It's the dysglycemia. Because what is diabetes? Dysglycemia describes a process, right? Dysglycemia describes a process. Messed up blood sugar. Dys, messed up, glyce, sugar, emia. It describes not a process, but a phenomena, something in the body. What is diabetes?
Brand name.
It's a word. Yes, it's a name. It's a word. It's a nominalization of a process. To nominalize something means to name it. Diagnoses are names, and all they are is descriptions. They don't help you. Fibromyalgia, fiber muscle pain. That doesn't help you. I got fiber muscle pain. How's that going to help me? It doesn't help you to know the name. And this is why the medical model fails. It treats names. It doesn't treat chemistry, because there's nothing in medicine that can treat chemistry effectively. Listen, there's nothing in medicine that can put a dysregulated system, a system that is out of balance, back into regulation. That's food. That's oxygen. That's detoxification. And if you want to go into mental and emotional and spiritual, it's those two, but it's not drugs. There's no drugs that can restore regulation. Let me just say this real quick. How are we doing? Am I talking too much here?
No, we got time, but I do have one other question,
Let me just say this real quick. Let me just say this real quick. The body's main job is to regulate. What does that mean, regulate? That means it's to respond appropriately to the environment. Regulation is when the body responds in a correct, healthy way to what's happening in the world, whether that is it's in our environment or whether it's food. Those are the two main places where the outside world comes into the inside world, through the senses and through food. Also oxygen. And so regulation is the body controlling. When you say you eat a bunch of food, it pulls the energy down. Or when you're under stress and you don't have enough energy, it pulls the energy up. Or when there's an emergency, it balances everything. That's called regulation. And that's the main job of the body, is to regulate, to make sure the inside biochemistry matches with the outside world, so you have an appropriate response. Does that make sense?
Yes.
Disease is dysregulation. We're not regulating correctly. All disease is dysregulatory. It means we're not regulating. Our reactions, our body chemistry is not appropriate for the world, for the response. So our blood sugar, when our blood sugar is high, instead of dropping, it stays high. Or when there's an emergency, we don't have enough cortisol to fight it. Or when we're just going about our day, our thyroid hormone we don't make enough thyroid hormone in order to function appropriately. So the chemicals are not being secreted in a way that is appropriate for the environment. The environment hits the body and chemistry happens. But when we're sick, the chemistry doesn't happen appropriately. We don't regulate correctly. The major cause of dysregulation is inflammation. It's inflammation that throws everything off. That's why I said earlier, remember the 1 point. We took the 3 points and we took it down to 1 point. What is it about dysbiosis, SIBO, and digestive problems that lead to health problems? Inflammation. What is it about dysglycemia that leads to health problems? Inflammation. What is it about hypercortisolemia, too much cortisol, stress hormone, and not enough thyroid hormone? That 3rd point on the triangle of disease? Inflammation. Inflammation is the core problem. And inflammation disturbs the body's ability to control things, to respond appropriately. And that's why chronic inflammation is so problematic. Now, short-term inflammation is important for survival, but chronic inflammation is dysregulatory. So work on the inflammation, which means digestive system, blood sugar system, and the 3rd point in the triangle of disease. Those 3 points, the reason they're so fundamental is because that's where inflammation really becomes a problem. That's where the inflammatory response begins. Now, all other health challenges are going to be inflammatory too, but it all starts with the triangle.
Okay. Just real quick, I don't know if you can help us with this one, but Barbara, one of the coaches, mentions that her client is trying to lose weight. She's 51 and get her blood sugar down. She's been drinking a keto shake for about a month and a half. Her blood sugar's come down some, but still high. She's taken some other products. Should she be switched to this Slender FX? I mentioned to her the sweeties, but I'm wondering what you kind of think about the use.
Again, the triangle. First of all, there's obviously if you have a weight problem, you got a blood sugar problem. Period. Now the thyroid might be involved, cortisol might be involved, the digestive system might be involved. Remember, I talked earlier how SIBO leads to dysglycemia, leads to more SIBO, leads to more dysglycemia. You get this circle, right? And also cortisol leads to dysglycemia. Hypercortisol, too much stress hormone, leads to messed up blood sugar, dysglycemia, and hypercortisol can throw off digestive health. So you get another circle. So all of these things they create what are called negative feedback loops, where one thing leads to another, leads back to the first thing, leads back to the second thing, back to the first thing, and it goes down and down the drain, essentially, in this downward spiral. So you got to break the spiral. You got to break the circle. And the first thing to do to break the circle is work on digestive health. So if this gal is noticing she's getting some results from her, I assume she's on the Healthy Start, or she's just doing the keto shake. She's not doing the Healthy Start Pack?
She's clearly taking the Start Pack.
Okay.
She's got to
get her on the Healthy Blood Sugar Pack for sure. But if this woman is 53, you said 53, right?
51.
51. If this woman is 51, guaranteed she's got some kind of digestive health challenges too. It's not possible to be overweight and not have digestive health challenges because of this triangle. If you are overweight, it's not possible for you to have good digestion. And another thing about digestion, by the way, and this is for health coaches, people don't recognize what a digestive problem is. They don't know that their heartburn or their hiatal hernia, and this is something I talked to a mathematician maybe a week ago or 10 days ago, super smart guy, told me he had no digestive problems, but as I was talking to him, he says he has a hiatal hernia and he has chronic heartburn. He didn't know they were digestive. He's a mathematician.
Right. Well,
he's a smart guy, and he didn't know they were digestive. So people don't know they're digestive. They don't realize their hiatal hernia is digestive or their chronic constipation is digestive. They don't know. So when somebody says I have no digestive problems, but they're overweight and they have a blood sugar problem, or anything. So you have to probe a little bit. This is for the health coaches or for anybody who's listening, really, but especially for the health coaches. And secondly, when you have a problem your whole life, you don't notice it. And some people have had bowel problems or bloating problems or digestive discomfort problems their whole life. And so they don't notice it. It just goes under the radar. And so you have to that's why fasting and a food diary are so important, is to get people to notice things. When you fast and stop eating and then you start eating again, you notice things a little bit more profoundly, a little more dramatically. Things become a little bit more clear. You'll say, oh my God, every time I have corn, I bloat, but I never noticed it before. So you'll start to notice things. That's why I like people to do a fast and then do a food diary. And all health coaches, listen up. You want people to participate in their health. You don't want to be the kind of person that just do this, do that, the other thing. You want the customer participating. The patient should be participating in their own health. Our job is to be guides. We're not the heroes. Our patient is the hero. Our client is the hero. Our customer is the hero. We're Yoda. They're Luke Skywalker. We're the guide. We're helping them. We're helping them be great. We're helping them be heroic. We're helping them be their best. But we're not the hero. They're the hero. And so you want them participating in their health. I always tell people to do a food fast and do a food diary. Another thing that does is you get to see if they're really interested. A lot of times people they're not really interested and you're wasting your time. So if they don't want to participate, they're, you can't help everybody. Another thing having them do a food diary is there's plenty of people who need our help. We don't have to feel like we have to help everybody. There's plenty of people who need our help. If they don't want our help, then fine. Did you ever see that Bugs Bunny cartoon where Bugs Bunny is walking the little old lady down the street and she's hitting him with her umbrella? Yeah. Right? She doesn't want to be helped.
That's right.
Sometimes people don't want to be helped. So you got to let people be, right? But there's plenty of people who definitely want our help. So have them do a food diary. That way you'll see who's really vested in their own health. It allows them to be the hero. it shows them the impact of their lifestyle choices. It shows them that their arthritis isn't just random. Do you know when you eat a food that's spiking histamine, your arthritis will get worse? When you eat a histamine containing food, your arthritis will get worse. When you eat a sugary food, your arthritis can get worse. People don't know, but when you do food diary, you start to notice these things. You start to notice the relationship between your health issues and the kinds of foods you're eating. That's a very powerful thing. It's very scary to not know what the heck's going on. When you start to see what's going on, that's really empowering. And you know what else that a food diary and fasting does? It shows them you know what you're talking about. Because all of a sudden they're going to notice results. And they could have been going to doctors for years, like this lady with 8 different problems, all related to the gut, that seem like they're completely different. It's going to demonstrate for them that you know your stuff. And so there's multiple reasons why you want to have your customer, your patient, your client doing ideally a fast. That's not, if they really don't want to do fast, okay, but a food diary for sure. Fasting definitely helps. Okay, what was you said you had one more question? Or
well, that was pretty much it then.
Did I answer everybody's questions?
You handled it and with grace as usual.
Thank you. We're here to make a difference in the world, and we are making a difference in the world, a huge difference. And thank you to Dr. Wallach for starting this whole great adventure that we're all on, and this great business that we're all participating in, and these wonderful supplements that we all get to enjoy and recommend.
Well, Ben, I will see you next time. I'll see you on
Thank
Daily
you.
with Doc Friday.
Daily with Doc it is. Bye, everybody.